Good morning and welcome to Webinar Wednesdays with SMP. We're happy to have you all join us this morning for a webinar on prescription drug fraud and scams. My name is Sunny Lawless and I am the Assistant Program Director for our SMP programs. Presenting for us today will be Jeanette Ringo, a Community Outreach Specialist in Mississippi, and Heidi Arnold, who is our Administrative Assistant. And as I mentioned today, for the August installment of Webinar Wednesdays with SMP, you're going to learn about pharmacy and prescription drug fraud. During the presentation, you're welcome to type in any questions that you might have into the chat, but we're going to hold all of those until the end of the presentation. And then after our presentation today, there will be a prize drawing for a $25 Amazon e-gift card. You needed to be registered to attend the webinar prior to 10:15 a.m. this morning in order for your name to be entered into the drawing, and you do have to be present to win. Before we get started, I do have to let you know that this presentation or this project is supported by the Administration for Community Living, Department of Health and Human Services as part of a financial assistance award with 100% of our funding by ACL and HHS. The contents are those of the authors and do not necessarily represent the official views of, nor are they an endorsement by ACL, HHS, or the US government. So who is Senior Medicare Patrol? Well, SMPs are grant-funded projects, as I said, from the Department of Health and Human Services and the Administration for Community Living. All SMP grantees have a shared national identity through a national program name and logo. Every state has its own SMP program. In Georgia, Louisiana, Mississippi, and Vermont, the SMP programs are sponsored by AdviseWell. And the mission of the program is to empower and assist Medicare beneficiaries, their families and caregivers to prevent, detect, and report healthcare fraud, errors, and abuse. And we do that through outreach, counseling, and education. Now, before I turn things over to Jeanette to get us started with today's presentation, we do have a quick polling question for you. And our polling question today is, do you have prescription drug coverage as part of your Medicare plan? So let's go ahead and launch that poll. Do you have prescription drug coverage as part of your Medicare plan? So go ahead and answer. Our options are yes, no, and I'm not on Medicare. And we'll give everyone just a few moments to enter their results. Okay, just a few more seconds. Get those answers in. All right, we're going to go ahead and lock it and share the results. So 54% of you said yes, you do have prescription drug coverage as part of your Medicare. 8% said no, and 38% of you are not on Medicare. So now I'm going to turn things over to Jeanette, who will get us started with information on today's presentation. Jeanette?
Good morning. I'm Jeanette Ringo, a Community Outreach Specialist in Mississippi. So today for the August installment of Webinar Wednesday with SMP, we're going to learn about pharmacy and prescription drug fraud. So what is Part D? It is Medicare prescription drug coverage. It covers most outpatient prescription drugs. It is a separate insurance plan that has a monthly fee. Next slide, please. Pharmacy prescription drug fraud is a consistent trend in Medicare, ranging from healthcare providers to drug trafficking organizations. It has a strong illegal market for prescription drugs, such as controlled drugs like opioids and expensive medications. Thank you. Next slide, please. Now we're going to take a look at some types of pharmacy prescription drug fraud. A pharmacy will intentionally provide you with less medication than you were prescribed. A pharmacy issues you expired medications. You are provided with and billed for an expensive compound medication when another less expensive prescription was ordered. Next slide, please. More types of pharmacy and prescription drug fraud are: you are offered free or discount prescription drugs, then they bill Medicare. Auto refills a prescription you no longer need. You never pick up, the pharmacy then bills Medicare. Someone offers to pay for the use of your Medicare number to bill for prescription drugs or offer you cash or other compensations to pick up prescriptions on your behalf. Next slide, please. Pharmacy prescription drug fraud and medical identity theft is another component we need to be aware of, such as be wary of providing your Medicare number and other personal information at events or public places. It occurs when someone uses your Medicare number to submit fraudulent claims. It could disrupt your care and cause financial harm. Next slide, please. There are ways you can spot pharmacy and prescription drug fraud. They are: a doctor assesses your condition before prescribing you any medication. Never give your Medicare number to unknown individuals requesting it for prescription drug services. Next slide, please. So now we're going to give you some BOLOs, which means that you need to be on the lookout. You can be on the lookout for these pharmacy and prescription drug fraud situations. Prescriptions that were never picked up, delivered, or even prescribed. Prescriptions that were prescribed by a provider you have never seen. Amounts beyond the quantity you were prescribed. A different drug than the one you were prescribed, or one not approved by the FDA. Next slide, please. Now I will turn it over to Heidi, who will review the SMP 3 keys to success in preventing fraud, errors, and abuse.
Good morning. My name is Heidi Arnold, and I'm the Administrative Assistant for Advise Well with SMP. The first key is prevent. Protecting your personal information is your best defense against healthcare fraud and abuse. Share your Medicare number only when necessary, such as at a doctor's office or pharmacy. Only carry your Medicare card when you know you will need to use it. Remember, Medicare will not call you to ask for your Medicare number for any reason. Keep records of all medical visits and procedures that take place and medical equipment ordered. Next, please. The second key is detect. Knowing how to spot suspicious activity can help you stop healthcare fraud and abuse in its tracks. Review your Medicare Summary Notice, MSNs, or Explanation of Benefits, EOBs. Your Medicare Summary Notice is mailed to you by Medicare every 3 months. If you have a Medicare Advantage plan, you will receive an explanation of benefits after you receive healthcare services. Compare your statements to your personal records and look for the following items: Medicare appointments, medical appointments you did not attend or were double billed for, medical equipment such as braces, catheters, and diabetic supplies you did not order or receive. Next, please. The third and final key is report. If you suspect you have been a target of fraud, report it. This will help you and others at risk for healthcare scams. Here are some steps to report suspicious behavior. If you receive a suspicious call, don't give out any personal information. Report the call immediately to us at SMP. If you have questions about your Medicare statements, call your healthcare provider or plan. If you aren't comfortable calling your provider or you aren't satisfied with their response, call SMP at our 877 hotline number shown on your screen. Next, please. You might be wondering how you can help and become involved. Senior Medicare Patrol is always looking for individuals to join our fight against Medicare fraud. Our volunteers receive training on the basis of Medicare and healthcare errors, fraud, abuse, and scams. In addition to giving presentations and attending community events, our volunteers participate in bi-monthly webinars and various training opportunities throughout the year. We also host a volunteer appreciation event in April for National Volunteer Week. Volunteering for the SMP program is extremely flexible and done on an as-needed basis. They determine how often they would like to participate. If you think volunteering for SMP is something you might be interested in, give us a call at our toll-free number, 877-272-8720. We can send a volunteer information packet and answer any questions you might have about the process. Next, please. Want to stay up to date on the latest scams impacting older adults in your community? Just scan the QR code using the camera on your cell phone to be guided to our social media platforms, including Facebook, YouTube, and our podcast, Sip and Learn with SMP, on Spotify and Apple Podcasts. Our state-specific SMP Facebook pages especially are a great resource for older adults and their care partners to find out about hot scams happening as soon as we learn about them from reports called into us or from our community partners. Next, please. As mentioned in the previous slides, we have a toll-free number at 877-272-8720. You can call to report potential healthcare fraud or to ask us questions about the potential fraud and even request to attend your event or speak to your group on our fraud prevention message. The SMP cannot be successful in fighting Medicare fraud without reports from people like yourself and invites allowing us to reach older and disabled adults in your community. Additionally, you can visit our website at www.stopmedicarefraud.org for more information about the SMP program in your state. Our website can be viewed in multiple languages by adjusting the language tab at the top right part of your screen. Next, please.
All right, thank you, and Jeanette and Heidi for that information on prescription drug fraud and scams. Coming up next month for our webinar Wednesdays with SMP, we're going to be talking about open enrollment scams, because we know open enrollment will be opening mid-October and running through December. So we want to talk about some things that everyone should be on the lookout for during open enrollment. And that webinar is scheduled for Wednesday, September 24th at 10:30. So be on the lookout for the link to register for that sometime next month. All right, so now it is time for our prize drawing. Everyone who was registered to attend today's webinar prior to 10:15 a.m. this morning has been entered into the drawing. Give me just 1 second and we'll pull up my little prize wheel, and you do have to be present to win. Let's see. All right, we'll give it a spin. Let's see, LaShonda McKinney, I am not seeing that she has joined today, so we'll give it another try. All right, it looks like Miss Lisa Duffy is our lucky prize winner today. So Miss Lisa, I will be reaching out to you later just so we can make sure that you receive your $25 Amazon e-gift card. Let's get back to sharing our screen. All right. So now it's time for Q&A. If you have a question that you'd like to ask, we want to make sure that we give everyone an opportunity to ask any questions they might have about today's presentation or the SMP program. Now is the time. You can raise your hand if you like, and we'll unmute your line so you can ask, or you can type it into the chat. Okay, I'm not seeing any hands raised or anything coming in through the chat. So this will conclude our presentation today on, oh, it looks like we've got one hand. Mr. Joseph, you have a question. I've unmuted your line. You just have to unmute your phone. Let's see, Joseph Terriot, you have a question. Your phone is muted, so you have to unmute your phone for us to hear you.
Aha, I figured it out.
There we go.
Hello. Okay, yes, ma'am. So one of the things I have and some questions I have, if a fraud has been detected, so you know, and once a person's Medicaid number is out there to the fraudsters, what is the steps that they need to do to either change out their number or make sure that it doesn't go further?
So if they suspect that they've been a victim of Medicare fraud, we could help them by, if they call the toll-free hotline number, they'll speak to our complex interaction specialist, who is Johnetta Red, and she'll get some information from them. A lot of times we need to, see a copy of the Medicare summary notice, doctor's bills, trying to figure out, is it just, because sometimes there's just errors that are made that can be
Right.
resolved very easily with the providers. But if it is something that we truly suspect is Medicare fraud, then we report that, we refer it on to the appropriate agencies that, then handle it and take care of investigations and whatnot. But we also would report their Medicare number as being compromised. And so we would help them in knowing how to do that.
Right.
Sometimes Medicare will give them a new number.
Okay.
Sometimes they don't. It really just, depends on the situation and I think who we get at Medicare that particular day. But
Okay.
we definitely would report it as being compromised and,
Yeah. Because
let them
things happen, and
from
it'd
there.
hate to be that, unfortunately accidents happen if there's
Mhm.
already been a fraud, and then they try to go use it at the emergency room or something like that, and their number is listed as having a fraud. That could complicate issues for the person seeking care. So
Yeah, I don't think it would, hinder their care at that time. I think Medicare just would have it flagged as, maybe an account that has been compromised. And so they kind of look at a little more closely,
check.
than ones that have not. But it shouldn't affect, the care that they receive or how they receive the care. But
Check.
it's always still a good idea if they suspect it to, report their Medicare number as being compromised.
Okay, super. Thank you.
Sure, you're welcome. It's a good question. All right, you guys. Well, this is going to conclude our presentation today on pharmacy and prescription drug fraud. We will send you an email after the webinar today that does have a link to a short survey. We would really appreciate it if you would just take a moment to complete the survey, and that just kind of lets the Administration for Community Living know how we did with today's information. If you ever have any questions, please feel free to reach out, and we are happy to have you all here join us today, and we hope to see you all again soon for another presentation on Webinar Wednesdays with SMP. And thank you, Jeanette and Heidi, for presenting today.